Good evening and welcome back to my channel. I'm your host and tutor, Annalise Garrison. And tonight we're going to talk about something that often gets overlooked in our course of studies, and that is triage and disaster management for the NCLEX. So this is a very interesting topic and we need to learn it for the NCLEX. So let's get started. So if you don't usually take notes, please take notes tonight, because triaging in a disaster is not what you think it is. Believe it or not, first responders at the scene help the least injured person first. Why? Because our focus is on saving lives. We want to save as many lives as possible in the least amount of time. So when we do that, we want to remember the acronym TRIAGE. TRIAGE. We want to remember that. There's a couple of things I want you to remember in this presentation. I'm going to go over triage backwards and forwards. As I already mentioned, the goal here is, with the first responders, we want to save the most amount of people in the least amount of time. And then, remember, when I talk about external disasters versus internal disasters, external disaster is synonymous with a natural disaster. So these are the concepts I want you to remember as we go along. Now let's look at the acronym TRIAGE. In an external disaster, remember the word triage backwards. Okay, backwards. So what is triage backwards? Triage backwards is EGART. So, in an external disaster or at the scene of a multi-vehicle accident, remember that E stands for extremities. Examples of extremities could be a broken arm, a leg, all right? A broken leg, a broken arm, whatever the case may be. We want to save these individuals first, all right? After the broken leg, we want to go with G. G stands for GI wound. Examples of GI wound would be like something impaled in the abdomen, or maybe even abdominal pain, right? So an impalement, an open wound, nausea, vomiting. These are the type of things that stand for GI. A stands for an infection. You usually will not see this at the scene of an accident. You usually see infection at the hospital. But it's part of the word triage, so, we put it here, okay? I stands for intracranial pressure or mental status. Examples of this could be a head injury or the person's ability to follow commands. If we do the Glasgow Coma scale on scene, these would be examples of I, which stands for intracranial pressure, mental status. R stands for respirations. This would be if a person is unconscious or if a person is breathing slow. These are the type examples for respirations. And T stands for most traumatized are saved first. So T stands for trauma. Now, believe it or not, in a external disaster or, a motor vehicle accident, for example, at the scene, we help the most traumatized person last because our focus is on saving lives. So, when we bring the triage for further help, when we go to the hospital, right? Now we want to help the most traumatized first. Just the opposite of at the scene. So at the scene, you take the word triage and go backwards. At the hospital, you want to take the word triage and go forward. So T stands for most traumatized first. R stands for respiratory. Again, these are the people with breathing problems. You want to see them second. Intracranial pressure, mental status, you want to see them third. And infection, you want to see them fourth. All your GI wounds, you want to see fifth. And your broken extremities, they can wait, right? They're not going to die from a broken leg. They're not going to die from a broken arm. So you see those people last. So at the scene, triage backwards. At the hospital, take the word triage and look at the most injured first. Okay? Now you would think just the opposite. You would think you'd help the most injured first at the scene. But no, helping the most injured first would take too much time. Your focus at the scene is to save lives. Get them out of immediate danger. Now let's look at a question when we talk about, at the scene versus at the hospital, or at the scene versus our medical destination. Because sometimes people are so injured that we set up makeshift tents or hospitals at the scene because there's not so injured, because there's so many people, mass casualties. But anyway, let's look at a question. If you have your practice questions in front of you, we will be looking at question 2 for a at the scene example, and we will be looking at question 15 for an internal disaster, at your medical destination example. So let's look at question 2. The nurse is participating in an external disaster. The nurse should first see. Now, remember what I said, at the scene, external, at the scene. We want to take the word triage and go backwards. So that would be E-G-A-I-R-T. So look at question 2. And I want you to say to yourself, either put a T, a R, a I, a G, or an E, right? Now read them all first before you put the letters there. Alright? So let's do this. A 27-year-old client with chest contusions who has muffled heart sounds and has a blood pressure of 105/90. A 43-year-old client with abrasions on the face and lacerations on the forehead who has a Glasgow Coma scale of 10. A 54-year-old client with abdominal pain who has hyperactive bowel sounds and nausea. A 64-year-old client with an open fracture to the left lower extremity has diminished sensation in his lower left extremity. So, we would put a T for A because that is a trauma patient, right? They have chest contusions and muffled heart sounds. We would want to put a I for intracranial pressure or mental status, for B because it's a 43-year-old who has a head injury and has a Glasgow Coma scale of 10. So that would have an I for intracranial pressure, mental status. A 54-year-old with abdominal pain who has hyperactive bowel sounds and is exhibiting nausea, that would be a G for GI wound. And D, a 64-year-old client with an open fracture of the lower extremity, we would put an E for extremity. So A is T, B is I, C is G, and D is E. Let's pause for a moment and do question 15. Okay, now let's go back to question 2 and use that same question to teach you the meta tag system. Okay? Now, the meta tag system, some of you may have heard it referred to as the START system. Okay, that stands for Simple Triage and Rapid Treatment. And that was all developed in California in 1981, which really wasn't very long ago. So it's taken us quite a long time to come up with the system. But here we go, and I'm going to teach it to you. Basically, we have 4 colors. What are those colors? Black, green, yellow, and red. All right, 4 colors. Black, green, yellow, and red. Now, we don't really give out green tags, but green is for all the people that can follow your directions and get out of the way. So the first thing you want to do is set up a safety area, right? Let's say that oak tree 50 yards away. So tell everybody that can move, everybody that can hear the sound of your voice, whoever can get up, please go over to the oak tree. Alright? Whoever moves to the oak tree gets a green tag in your mind. And they don't necessarily have to go to the hospital right now. They have green tags. If they can walk, they can wait. Right? The next tag we have is yellow tag. What is a yellow tag for, ladies and gentlemen? Good job. These are people that have minor injuries. These are the people, if they have minor injuries, they can wait. Alright? We do give yellow tags because we want the ambulance to know who to pick up first. Alright? So now we've taken care of the least injured first, the green people, right? They walked over to the oak tree. We have the yellow people, the minor injuries that can wait. We want to give out red tags. What is a red tag? The person who is injured critically and needs medical attention stat. Remember, at the scene of a disaster, a multi-vehicle accident, whatever it may be, our focus is on saving lives. Okay? So if a person is critically injured and needs immediate attention, he gets a red tag. And then, of course, the black tag goes to what? The person that is unsalvageable or dead. How do we know a person is dead? We want to remember the acronym RPM. These are for black tagged individuals. If you think the person is dead, in a real disaster situation, we don't have a stethoscope, we don't have a pin light, we don't have any medical equipment, and we have 60 seconds or less to tag the person. I used to work for the state of New Jersey, and we did disaster drills quite frequently. So this is very important. So remember the acronym RPM. R is respirations, P is perfusion, and M is mental status. So that means if they're not breathing, okay, if they don't have any pulse, and if they're unconscious. Not breathing, no pulse, unconscious, give them a black tag. Now, the minute you think they're not breathing, no pulse, and they're unconscious, turn them to the side and assess them again. You know, try to move them first before you just slap a black tag on them, right? So move them first and then assess them again. If again they fail the respiration, perfusion, mental status test, give them a black tag and move on. The goal here is in a disaster is to save as many lives as quickly as possible, right? So having said all this, let's look at question 2. And now let's just give them a color tag. What color tag would you give A? A 27-year-old with chest contusions who has a muffled heart sound and has a blood pressure of 105/90. What color tag would you give that person? Right, you would give that person a red colored tag because that person needs to get to the hospital immediately because of the chest contusions and the muffled heart sound. What color tag would we give B? A 43-year-old with abrasions on the face and lacerations to the forehead who has a Glasgow Coma scale of 10. Remember that the Glasgow Coma scale measures 3 behaviors: eye-opening response, best verbal response, and best motor response. Remember, the higher the score, the better the best response it is for the client. So the highest score is 15 on the Glasgow Coma scale. So this is a Glasgow Coma scale of 10. So they're kind of in the middle. So what color tag would we give them? Yellow. Okay. Let's look at C. A 54-year-old client with abdominal pain and hyperactive bowel sounds and nausea. What color would they get? They can wait, right? So I would give them a yellow tag, right? And a 64-year-old client who has an open fracture of the lower left extremity, who has diminished sensation in his left lower extremity. What color would you give that person? You would give that person a yellow tag, right? Anyone, let's go over it again. Anyone who can walk and refuses treatment gets a green tag. Anyone who is injured but they can wait gets a yellow tag. Anyone that is critically injured and needs to go to the hospital immediately or they will die, right, gets a red tag, all right? And then anyone who fails the RPMs, right, not breathing, respirations, or P, perfusion, no pulse, and M, mental status, unconscious. So not breathing, no pulse, unconscious, gets a black tag. So that's the meta system. See, you take the word triage and go backwards, EGAIRT, you tag them, then when you go to the hospital, now we see the most injured first. Take the triage and go forward, TRIAGE, the most traumatized first. Take the red tag first at the hospital, and then the yellow tags. And then, you know, maybe the green might trickle in, and then the coroner will take the black tag people. Okay, so that is this presentation. That is the triage system and the meta tag system. Good luck on your NCLEX, and I will see you in the next video.